A report by the Consumer Advocacy and Empowerment Foundation, CADEF, reveals that 94% of Cerelac and other leading baby foods sold in Africa contain high level of added sugar. The study, supported by Swiss watchdog Public Eye, raises concern over what babies in Nigeria are being fed, noting that these products contain more sugar than those sold in other parts of the world. CADEF's Executive Director, Professor Chiso Ndukwe Okafor, says Cerelac in Nigeria has up to 5 grams of added sugar per serving, while the same product in Europe contains none.
Culmination of a study that was done late last year, on looking at specifically added sugars in infant formulas, and the result of the study, which showed that over 4 grams, almost 5 grams of sugar was found in baby food. Specifically, we looked at the Cerelac, but other baby food manufacturers also added sugars to their products. And we wanted to let people know that additional sugar to infant formula was not necessary, because the same products made by the same manufacturers in European countries or in UK was 0 added sugar. And when the same study was done in India in 2024, there was a big uprise that forced the manufacturer to now produce 14 variants of infant formulas with no sugar added to it.
Representing the Standard Organization of Nigeria, SON, Jibril Muhammad says new regulations on baby food targeting sugar contents could be introduced within a year. He maintained that the agency does not ban products but sets standards guarded by public health.
I haven't observed what is here. Our standards generally are not static, are not fixed. We normally review our standard after every 5 years to ensure that it accommodates changes in the technology, advancement, even policies. If tomorrow the Nigerian government decided that sugar should be banned, automatically our standards must be reviewed to accommodate that. So I have not, even as an adult, we've been hearing campaign that sugar is not good for us. Everybody have been hearing that, but you cannot say as an organization working for government, you stand up one day and say you have banned these things. There must be reason to that. It's beyond my scope to say whether we have banned it or not. Our is just to see that what the policies say we implement.
A representative of the Federal Ministry of Women Affairs, Child Development Department, Mr. Adeyemo Adebayo, says urgent nationwide awareness is needed, warning that many parents are still unaware of the risks of added sugar in infant diets, stressing that babies do not need sugar at all, calling for advocacy to reach communities, religious and traditional institutions.
Most people may not know that babies do not need added sugar, because when you go to the market, you see the Cerelac, even it is out of reach of the ordinary person. But how will they be enlightened? How will they be educated? It is through this advocacy, take it beyond National Assembly, take it to the traditional ruling institutions, religious leaders, and then we not stop at nothing.
Speaking from a clinical standpoint, the Pediatric Association of Nigeria, represented by Dr. Anthony Bauer, called for stricter regulation and stronger local research on added sugar in children's diet. Dr. Bauer says academias and policymakers must work together to drive enforceable national policy.
From medical school, School of Nursing, College of Health, Tech, if we push this and people at that level understand the danger of added sugar in serious baby food, when they get into work, they'll actually advocate. And then also the academia will really go a long way. It should be a very clear stakeholders. And then the Federal Ministry of Health.
CADEF cited global examples, noting that Nestle has rolled out sugar-free Cerelac varieties in countries like India after regulatory pressures. The foundation says Nigeria must follow suit to protect children in Nigeria and Africa. High level of added sugar in baby food can shape early taste preferences, Experts warn it can also contribute to early weight gain, poor nutrition, and the rise of obesity, diabetes, and teeth decay later in life. Marianne Awia, PS News.